A pulse oximeter is a device commonly used to monitor a patient's heart rate and arterial hemoglobin's oxygen saturation during anesthesia. A good pulse ox reading is an SpO2 of 98 to 100%, but a reading around 96 is considered the minimum. Anything lower than that is hypoxemia, poor oxygenation, and may require immediate assistance. On our feline patient, the pulse ox was placed on a toe since it was lightly pigmented and out of the way during his dental procedure, and it worked quite well. There are many placement locations: lingual, on the lip, vulva, prepuce, pinna, toe. The tongue is the most common and readily accessible, but you want to make sure that the patient doesn't wake up and bite it, because then that can damage the probe. But if a tongue is not available due to the procedure or other means, there are other places that can be used. Placement should be considered by pigmentation, procedure, tissue thickness, location, since dark pigmentation, super thin or thick tissue, patient movement, or an interference such as an overhead light can cause poor, inaccurate readings. Pulse oximeters are a very handy, non-invasive, painless tool for monitoring during anesthesia or just monitoring hemoglobin oxygen saturation in general, especially if it's a concern for your patient. Always pay attention to the patient as well. If you are getting any funky readings, check your patient first: heart rate, respiration rate, capillary refill time, mucous membrane color, then readjust the machine if it isn't matching the patient. Always check your patient before fiddling with the pulse ox probe. This way you can make sure the pulse ox is accurate and you are getting the proper care for your patient.